Today we're talking about a topic that worries a lot of parents: hair loss in children. If you've noticed thinning patches, bald spots, or more hair in the brush than usual, it's completely natural to feel concerned. The good news is that in many cases, hair loss in kids is temporary or treatable. Knowing what to look for can help you feel confident and calm. First, it helps to understand that some hair shedding is completely normal. Children, like adults, go through a hair growth cycle. Hairs grow for a period called the anagen phase, which can last several years. Then they move into a short transition phase, followed by a resting phase called telogen. During the resting phase, hair naturally falls out to make way for new growth. This means that seeing a few hairs in the brush each day, often with a small white bulb at the end, is usually nothing to worry about. Now, let's talk about common causes of hair loss in children. One of the most well-known is alopecia areata, an autoimmune condition that can cause round, smooth bald patches on the scalp. The onset can be sudden, but hair may regrow on its own, or a doctor can help guide treatment if needed. Another frequent cause is tinea capitis, a fungal infection that can appear as scaly patches, sometimes with redness or bumps. This requires antifungal treatment prescribed by a GP. Children can also experience hair loss due to telogen effluvium, where stress, illness, or rapid growth changes push more hairs than usual into the resting phase. This usually results in diffuse shedding across the scalp, rather than distinct bald patches. Hair often grows back once the trigger is resolved. Nutritional deficiencies, particularly low iron or zinc or inadequate protein intake, can also affect hair growth. If your child has hair loss along with fatigue or slower growth, it's a good idea to check with a GP. Another important cause is trichotillomania, a behavioral condition where children pull out their own hair. This can lead to patchy hair loss and is often linked to stress or anxiety. It's important to handle this gently and without blame, and professional support may be needed to help the child manage the behavior. Now let's move on to gentle hair care routines that support healthy growth. Start by washing your child's hair with a mild, tear-free shampoo. Avoid harsh chemicals or shampoos designed for adult styling. Use a soft brush or wide-tooth comb, especially on wet hair, to prevent unnecessary breakage. Tight hairstyles, like ponytails or braids pulled too tightly, can stress hair follicles and cause traction alopecia, so keep styles loose. Encourage your child to air dry their hair when possible, or use low heat if blow drying is necessary. Nutrition is also key. Make sure your child's diet includes protein-rich foods like eggs, fish, beans, and dairy. Iron-rich foods such as leafy greens, lentils, or lean meats support hair growth, as does zinc from nuts, seeds, or whole grains. A balanced diet with plenty of fruits and vegetables ensures they get vitamins and antioxidants that keep hair and scalp healthy. Let's do a quick myth versus fact break, because parents often get confused. Myth: if my child loses hair, it's permanent. Fact: most hair loss in children is temporary and often regrows once the cause is addressed. Myth: shampoos or special hair products can stop hair loss. Fact: hair loss is usually caused by internal factors like stress, hormones, or nutritional deficiencies. No shampoo alone can reverse it. Myth: pulling hair is always intentional. Fact: in conditions like trichotillomania, hair pulling is often subconscious or linked to anxiety. Gentle support is more effective than punishment. Quick facts about hair loss triggers: stress, illness, infections, nutritional deficiencies, or behavioral conditions are the main contributors in children. Importantly, the scalp and hair follicles in children are very resilient, which is why early detection and care usually lead to regrowth. So when should you seek help from your child's GP? If hair loss persists for more than a few weeks, bald patches appear suddenly, the scalp shows redness, scaling, or pus, or your child has other health concerns like fatigue or slowed growth, early evaluation ensures the right diagnosis and treatment, and it gives you peace of mind as a parent. To reassure you, seeing a few hairs fall is normal, and even noticeable patches often resolve with proper care. Gentle handling, good nutrition, and early medical guidance are usually all that's needed to keep your child's hair healthy. In summary, some shedding is normal, most causes of hair loss in children are treatable, and early attention combined with gentle care and proper nutrition makes a big difference. Remember, if you're ever unsure, a GP can help guide you safely. If this video helped you understand hair loss in children, like and subscribe to Dr. Follicle for more science-backed hair and scalp advice. Thanks for watching, and I'll see you in the next video.